Good afternoon, everybody, and welcome to this CPD Week 2026 webinar, How Professionalism Affects Your Practice. My name is Hugh Tregoning. I'm Professional Liaison Consultant for Wales. I'm also privileged to be a physiotherapy registrant of the HCPC and continue to practice with the permission of my employer. So before we start, some basic housekeeping. This session is 45 minutes long. You will have noticed that your mic and cameras are off. There is a Q&A which you can access via the Q&A button. It's open for comments, but due to the size of the session today, we won't be able to answer the questions. We're not providing certificates at the end of this session, but this can obviously form part of your CPD, and we would encourage you to use the reflection points throughout the session if you intend to do that. And you will be getting a follow-up email which will contain the slides, the recording, and some helpful resources. So we will be using Slido polling during this session. Hopefully you've used it before, but if not, it's very straightforward. So you access the poll via a QR code on your phone, or you can navigate to slido.com in your browser and enter the code that will be displayed on the screen. So the code for this poll is profinprac. So you can enter that. You don't need to log in at slido.com. You just put it in the box, profinprac, and that will get you in for the polls for the rest of the session. Or you can use your phone and use the QR code, which is available on the screen. So to begin with, what I'd like to ask you is if you could rate your knowledge and understanding of this webinar topic. So professionalism, what does it mean to you? What do you understand about it? So 1 is not very confident, 5 extremely confident, and everything in between. So the threes are winning it at the moment. I'll just give you a few moments to jump in and give me your answers. And thanks for being so quick on the fingers and on the buttons. So it's great to see the numbers climbing up. We've got a couple hundred people there. Only 6% at the 5. So thank you very much for attending this session. Hopefully you will know more towards the end of the session. So the 3s have definitely won it with 50% of the vote. I will be moving on shortly, but thanks for taking part. So what is CPD? Well, CPD exists for patient safety. So regulation in healthcare exists to keep patients safe, to keep service users safe. And our role as a regulator is to support registrants to practice safely and effectively. And to do that, they need to keep their skills and knowledge up to date. So you or I, as registrants, need to keep our skills and knowledge up to date. And we do this partly through CPD. CPD is specific to our scope. It's outcome-based, so as opposed to other regulators where they need a certain amount of points or hours, we do not follow that model. And it's very much self-directed and self-managed, so it doesn't require sign-off. So this connects with the why of the regulator, so why regulation exists, why HCPC exists. And as I've already mentioned, our role is around public protection. Many of you will be familiar with the regulatory functions of the HCPC around quality assuring education, setting standards, maintaining a register, and undertaking fitness to practice investigations and processes. But we also have key arms around learning and preventative action, whether that's using our own data and insights and our own research, or leaning into other people's learning and sharing good practice widely across the system to meet that aim around protecting the public. So public protection is absolutely key to what we do and why we do events like CPD Week and encourage healthcare professionals to participate in CPD regularly. So to a bit of an icebreaker, I'd like to ask you what you think is the most dangerous occupation. So just to chat you through the options on the screen, we've got commercial fishing, we've got construction, agriculture, soldiering, so being in the military but not in an active combat zone, and firefighting. So I'll give you a few moments to muse on that. We do have a Slido poll. So what do you think is the most dangerous occupation? And there is a something else option in this poll. So agriculture has the lead at the minute. I come from a farming background and I won't tell you about them on this webinar, but I have had a few injuries farming. You can message me, you can email me afterwards if you're interested, but it can be a pretty dangerous job to do. There's something else is climbing. Be interested to know what your something else's are. Maybe you can put them in the Q&A and can have a look through them afterwards. So I'm going to move on in a second. Unfortunately, this is a bit of a trick question. So I'm going to say that I believe there's a good basis to argue that sedentary work of all types are a significantly underestimated health risk. So of course, the other jobs are high risk. So things like construction, commercial fishing, agriculture, logging have a higher risk, higher acute risk of injury and death. And sedentary jobs have a low immediate injury risk, but significant longer term health risk. So you think about potential causes of back pain, which is the leading cause of disability worldwide, but also chronic disease risk around heart disease, type 2 diabetes, and certain cancers as well. So why have I done this little exercise? And hopefully you can forgive me for the slight subterfuge when we're going through, but what's the key message here is that the greatest harms are often not the ones that are most obvious, the ones that we can see most visibly. They're often embedded in culture and everyday practice of the ways where we work. The harms are often widespread, they're often quite normalised, and often quite hard to recognise. And that brings us back to our topic around professionalism. Professionalism in some areas, particularly on the backstage, where we're not patient-facing, can feel like a nice to have. But actually, what we know from the evidence is that it's critical to patient safety. So let's talk about safety. So there's important caveats when you're talking about avoidable mortality, that definitions vary widely on what different research sources consider avoidable, treatable, preventable. The terms themselves differ, and how we measure it. So the Office for National Statistics gather data for England and Wales, and this is from their 2024 data set. And they estimated that around 121,500 total deaths were avoidable. So these could be preventable through effective public health or timely and effective healthcare. And around 43,508 of those were treatable or potentially linked to suboptimal healthcare. So retrospective acute hospital reviews such as the PRISM study 2012 and other more recent ones do suggest that there are significant numbers of avoidable deaths or preventable deaths, and they often result from system, cultural and organisational factors rather than merely a lack of competence or bad actors or bad apples, if you like. So where does this place us internationally? Well, one study, so the Global State Patient Safety Report 23, placed us 21 out of 38 OECD countries. So these are countries of equivalent wealth. So whilst we have a brilliant healthcare system, it is remarkably safe, and most encounters, people are not harmed and they get the care that they need. What we probably need to accept based on these figures is that the system is not as safe as it could be. So to put a bit of a story around those figures to help us understand them, it's equivalent to 105 Boeing 747s being lost each year, or the Principality Stadium in Cardiff being 58 full. Now, anybody who has lost somebody who perhaps shouldn't have been lost or experienced avoidable harm as a result of the health system, like I have, will understand the impact, the real human cost of these figures, and why we really focus on them as a healthcare system. So professionalism, why do we talk about it? Well, the research is getting stronger all the time and showing how critical it is as a factor in ensuring we deliver safe and effective care. So professional behaviours are one of the main things which determines positive patient experience. They play an absolutely vital role in safety culture, but they also help staff morale, they help well-being behaviours, they help staff to be in work and to be healthy and able to work effectively when they're there as well, and not to be off sick. And these are just some of the research findings. I encourage you to kind of look at more if you're interested, and we will provide some follow-up resources around this topic. So a reflection for you. So if you intend to use this session for CPD, what I encourage you to do is either make a mental note or jot some thoughts down in a Word document or on a pad if you're old school like me, and just write down what words come to mind when you think about the term professionalism. So professionalism is pretty challenging to define, and that's partly because it's complex, multifaceted, and has many different components that make it up. But it's widely accepted to be an essential element of effective healthcare. It's something to do with people's skills and attitudes and behaviours, but it's also about respect and clear communication, and these things that are really prioritised by the public. So when we go out and we revise the standards, which we do every few years, the themes that come through from the public and key stakeholders in that space is they expect healthcare professionals to be professional, as the name suggests. So it can be defined in many ways. This is a definition by Harkin, 23. Professionalism is a set of values, behaviours and relationships which underpins the trust the public has in doctors, nurses and health and social care professionals. So these are some components which may make up professionalism. So it is about technical competence, it's about knowledge and skill and what you can do, but it's also about who you are, so those individual characteristics and values. And it's very much defined by context. So you're not just competent and you know stuff and you can do stuff, and you're not just a certain type of person, but you can bring those to bear in context with your patient, with your service user, or with your colleagues in a non-patient facing role. So it's inherently relational in nature. It's with your patients, it's with your colleagues, it's with your organisation, it's with your peers, and it's also built on trust. So there is so much research now around the criticality of trust. If we don't trust each other, communication breaks down, information doesn't flow freely. If patients don't trust us, if service users don't trust us, we don't know things we need to. They don't present at the right time for investigations, and it inevitably leads to harm. So professionals must be aware of the need for trust, but also be trustworthy. And then lastly, it must include an awareness of vulnerability. So just being a healthcare professional, whether we wear a uniform or not, whether we're in a patient-facing role or not, puts us in a privileged place, a position of trust and a position of authority and responsibility, and it comes with power. And when we have power and we come into contact with people who are vulnerable, and we will come into contact with some of our society's most vulnerable people, there is a risk that people can be taken advantage of intentionally or unintentionally. So another reflection for you: how often do you reflect or discuss your own professionalism, being that it's so important to safe and effective healthcare? And when did you last receive feedback from others about your levels of professionalism, whether that was positive or challenging? So to talk about our learning and preventative action, what do we know about unprofessional and disruptive behaviours? Starting with prevalence, we know that these behaviours are happening with high frequency across the healthcare system, both in public and private sector. So NHS staff survey is one sign of that, perhaps. It suggests 2024 that 1 in 5 staff had experienced bullying and harassment. 9% of that reported as it happening from managers and 17 to 80% from colleagues. And another example of unprofessional behaviour or boundary violation is unwanted sexual behaviour, which affects around 8 to 9% of staff. And 3.7 to 3.8 said they experienced that from a colleague or other NHS staff. So we know from this data and other sources, whether that be surveys, so hard data, or the stories that people tell us, and our own experience, that unprofessional and disruptive behaviours are quite prevalent in the health system. So I want to ask you at this point, what do you consider examples of unprofessional behaviour? So if you join the Slido poll as before, and it's a multiple choice poll, I'll give you a few moments to join that. It's always slightly anxiety provoking when you can't see anyone entering data. What a relief. So all of the above, really. So disrespectful communication, not maintaining confidentiality, using inappropriate language, punctuality, so arriving late or leaving early without good cause, sharing inaccurate information, not following clinical guidelines or processes. So there is a broad spectrum of behaviours that we would all consider unprofessional, and some of these we've probably partaken in, let's be honest, certainly witnessed, and perhaps been a recipient of as well. So the research shows that there is a spectrum of unprofessional behaviours, from inadequate records and not going to meetings, not responding to calls or emails consistently, and punctuality, all the way through to hostile communication, inappropriate jokes, incivility, to verbal outbursts, physical abuse, and sexual harassment, and so on. And the HCPC's own research shows that it's really important to identify signs of disengagement, particularly around professional practice and professional boundaries, as early as possible, because there may be opportunities to prevent professional drift, to prevent behaviours, values and beliefs and their underlying assumptions which are negative, escalating over time. And now to focus in on the impact. So I'd like you to consider, if you have experienced any of the behaviours we've mentioned or other behaviours, how does it make you feel? So have a think about how it makes you feel in that moment. If someone is rude to you, if someone raises their voice at you in an unprofessional way, if someone consistently ignores you. So when you experience unprofessional behaviour like these or others, how does it make you feel? And then a secondary question, if it doesn't make you feel good, how might that affect your work? And how might it affect your ability to keep doing your job to the best of your ability. So I'll just give you a minute or two to reflect on that one. So what we know is that there is a broad impact of these types of behaviours. So the recipient can experience physical and mental health challenges and problems coping with day-to-day life. People report it having a significant impact on family life. So it's not just inside work, but outside work as well. And ultimately their ability to stay working. But it also affects bystanders. So it can cause psychological and emotional distress in people who witness these types of behaviours. There can be a cultural impact as well. So bystanders can feel more isolated. They can feel unable to speak up. But they can also result in follower type behaviour, so mimicry, and ultimately professional standards in the whole team reducing. And these are not nice places to work, so that can affect retention as well. So all of that, if you consider these are colleagues in the health system, is bound to have an impact on patient or the service user. Patient and service users that witness these behaviours often have a reduced level of trust. And people experiencing these behaviours often don't give the best care, and they don't give good care day in, day out. So we get inconsistent care and safety issues and a general low quality of care and standards. And so you can see the broader impact on the wider system. Places where these behaviours are proliferating have increased patient safety incidents and staff safety incidents, negative cultures, issues with retention, and then legal and professional risks as well. So what research shows us is that when staff experience these behaviours, they're far more likely themselves to be involved in near misses and adverse events. Places where unprofessionalism is rife, where disruptive behaviours are frequent, have higher mortality rates, worse patient experiences, and poorer performance overall. Boundary violations undermine trust, they increase patient distress, and they increase a reluctance to seek care and increase the risk of litigation. And normalisation of these types of behaviours discourages speaking up, and we think that's due to a number of mechanisms. Firstly, people not sure what right is, not sure what good looks like. And people are also afraid to speak up because they don't know what the standard is and what the consequences could be for speaking up. Clinicians that are involved in these types of behaviours often display other professionalism lapses. It could be around their knowledge or level of competence more broadly, and this can raise system-wide safety concerns. So disruptive behaviour and unprofessionalism can be seen as a key indicator of unsafe culture generally, and you can see therefore why we focus on it, why colleagues in my team and myself, we go out and we teach about professionalism every week to different staff teams in different contexts. So how do we go about promoting professionalism in practice? Arthur Jones said, every system is perfectly designed to get the results it gets. So this is based on some research by Unger in 2023. And it sort of explains why, if you're working in a team where you see behaviours like these, perhaps not with a high frequency, or where you see them quite often, that they've probably been produced or co-produced by the system in which you are working. So if you look at the context on the left-hand side, places where people feel disempowered, where there are harmful workplace processes and cultures, where there are limited opportunities for people to spend time together, to get to know each other, where there's a reduced ability to speak up, where there's a lack of urgency and awareness from leadership. These contexts are more likely to generate unprofessional behaviours via the mechanisms you see in the middle. So there's an increased likelihood of staff to engage in behaviours, but also to be unable to call it out, to identify what good looks like, and therefore these behaviours are not challenged and not addressed and tend to escalate over time. And the outcomes you can see on the right, which we've talked about. So reduced staff well-being, reduced patient safety, and reduced care quality and experience overall. So that's the challenge. What can we do to support professionalism? Well, attending a session like this is probably helpful, but we forget 90% of what we learn within 7 days, according to the research. So it's not enough just to attend CPD sessions or to read papers or to watch videos on it. We have to rehearse, we have to model what we see, we have to help professionalism thrive by encouraging cultures that encourage professionalism. So it is about presenting opportunities for staff to spend time together, whether that's in supervision, whether that's in training. It could be around appropriate social opportunities. It's about recognizing where morale is in the team and finding ways to tackle low morale and support teams to improve in that area. It's about everyone being a leader where they are, everyone being accountable for their behavior, for their actions. It's about learning what happened rather than focus on who is to blame when incidents occur, and normalizing speaking up, but also challenging each other in the right way. So challenging at the right time, in the right way, particularly peer-to-peer, before it becomes formal, before things escalate over time. And workload is critical. So we can't do any of these things if workload is unmanageable. And sometimes there are seasons where service is under unrelenting pressure and we just have to get things done. But it's really important to be aware that workload is probably one of the biggest risk factors for helping unprofessionalism thrive. And we need to be better at discussing behaviour openly with one another, thinking about behaviour and standards of behaviour as part of our training programme, rather just focusing on competency, but also focusing on conduct. And remembering that incivility, which could be as much as an eye roll, can be enough to put your colleague off their job and lead to a mistake. So I'd like to hand back to you at this point and ask you, firstly, which of these areas do you think your team currently needs the most attention, before we go on to talk about perhaps some actions that we can take off the back of this session. So this is completely anonymous, so your names won't be published in the poll, but I encourage you to take part and let us know which areas you think your team currently needs the most attention. So I'm going to give you a good bit of time to fill this in so everyone has an opportunity to do so. And thanks to those who already have done so. So thanks very much for taking part in that one. And it's no surprise to me, we run polls like this fairly regularly, to see that workload is up near the top. And there are some really challenging conditions out there at the moment, and this is the impression that we get going out and talking to people and meeting with registrants and meeting with leaders and managers. So thanks so much for sharing. So what we can see is there are some key areas for us to consider as a challenge, and a potential challenge to professionalism, and a potential challenge to even having space or time to reflect on how effective we're being. So these might be some key areas for us to reflect on going forwards and to focus on in whatever capacity, whether we're leading from the front line, or whether we're in an actual formal management or leadership position. So thanks again for sharing and taking part in that poll. So what I'd like you to consider, and it doesn't need to be a big, grand action. Think small. So within your context and the challenging environment that you may be working in, what small thing can you do in the light of the challenges we've just discussed, but also the things which help professionalism to thrive? So this is an open text poll. So feel free to type in. Keep it polite, please. What small action can you take in the next 4 weeks or so that may help promote the existing excellent levels of professionalism, or challenge or tackle some unprofessionalism that you may be experiencing or witnessing? So making time to talk, starting a conversation, talking about professionalism, absolutely. Communicating better, reflecting, share the webinar, thanks very much. Call out unfairness, build teamwork, be more approachable. So what we'll do, I'll chat with the team to see if we're able to share these answers with you as part of the follow-up, because that might be helpful. So what you see at the top there is the most frequently cited words. So we've got team, communication, conversations, professionalism, and time. And I think that's a key point. So there's lots of really useful info in there, but actually finding the time and reflecting and knowing the importance of professionalism, knowing the importance of maintaining high standards and holding each other to account. The importance for our whys, like why did we come into our careers? Why did we come into our various professions? We certainly didn't come in to do harm. Sometimes in the business, we can lose sight of the impact of our actions on the patient and on our colleagues as well. So send this webinar to my team, thanks. I wish I could send you a Mars bar, but that would be unethical. Actually, I'll give you a few more moments to put that in, and as I said, hopefully we'll be able to share that with you afterwards in the follow-up email. Open conversations, reflections about situations, understand. Wasn't quick enough in reading that one. Excellent, thank you so much. I am going to move on now. We've just got a few more slides to get through. So another opportunity for an interaction here. So just to ask you, how confident do you feel about CPD in general? So it's on a scale of 1 to 5, 1 being not very, 5 being extremely confident. How confident do you feel about CPD in general? I think the 5s are a clear winner in this one. So it's absolutely fine to feel how you feel. That's what this week is all about, and hopefully you will have taken something away from today, not just about professionalism, but about CPD as well. I will show you some resources next, which might support feeling a bit more confident if you're not quite there yet, and show you some of what our website also has to offer you when thinking about CPD. So some of our CPD resources on the website. So we've got sample CPD profiles and examples of CPD evidence as well. There are some really good videos of professionals sharing views, tips and advice around CPD and keeping it up to date and recording of it and making the most of every opportunity. And there's also then a guide around what goes into a CPD profile if you do get audited when you come to revalidate. We've also got plenty of other guidance on the website around many different things, including around professionalism and professional boundaries, and there's a sexual safety hub as well. So do have a good look on our website. We have an employer hub and a registrant hub as well, which you can register with and get updates from us. So next steps, what we'd recommend you do next after this session, but also any of the other CPD sessions that you have attended this week, is to reflect. So you can either do that individually or you can do that with your team. You could get them to watch this session back as part of your training program and then reflect on it together and consider what you've learned and how it fits in with your previous knowledge, and particularly how you can use this to benefit your service and, most importantly, the users of your service, whether you're in a patient-facing role or if you're a laboratory scientist and you don't see the patients but are still a critical part of delivering safe and effective care as well. We have a reflective template that you can use, and we would encourage you to get involved in our other CPD week activities. So we've got other webinars coming up. You know, send the advert around your team if you could, and keep talking about CPD, professionalism and the other topics that we cover. There's a shout out from the communications team if you could share your reflection on social media. Hopefully you enjoyed it, and any more ideas just link to us on the website. So just to return to that question then, if you could. So at the start I asked you to rate your knowledge and understanding around professionalism, 1 being not very confident and 5 being extremely confident. If I could get you to complete that again, and I'm hoping that we've seen a shift in your scores. So the 4s and the 5s have it, which is reassuring. Thank you very much for taking part in all of the polls, and for your interest in this session and sticking with me to the end as well. Thank you very much. So we do have an evaluation form which can be accessed via the link, which you will get in the slides in the follow-up email, or you can do it for us now via the QR code on the screen. As I said, all the slides and some links to additional resources will be sent through to you in the follow-up email as well. And that's it. So thank you so much again for attending today. It was fantastic to have you here. We have a tendency to forget most of what we see on sessions like this in a short space of time, so I would encourage you to reflect on it. Really love to hear from you. I work for the Professional Liaison team. If we can support you in any way to come in and do sessions in your workplace, please also do reach out to us. And that brings us to the end of our session. Thank you very much.